Assalamu alaikum and welcome back to our channel. Today, we are delving into a topic that's universally relevant, yet deeply personal: hair loss. Now, we've all noticed a few extra hairs on our pillows or in our brushes at some point, right? But when does this become a cause for concern? And what can we do about it? Understanding hair loss, its causes, potential treatments, and preventive measures can be a game changer. In this video, we're going to demystify hair loss, explaining everything from the basic biology of hair to the latest cutting-edge research on treating and preventing it. So, whether you're experiencing hair loss yourself or just want to stay informed, stick around. Hair loss is a universal phenomenon, affecting both genders across all age groups, races, and cultures. Historically, hair has held significant symbolic and aesthetic values, making its loss a cause for concern, distress, and, in many cases, a blow to one's self-esteem. Understanding the causes, potential treatments, and preventive measures for hair loss is, therefore, of paramount importance. Before delving into the causes and treatments of hair loss, it is crucial to understand the biology of hair. Hair grows from follicles, tiny bulb-like structures embedded in the skin's dermis. Hair growth happens in cycles and is influenced by hormones, age, and genetics. Each hair strand has a life cycle divided into 3 phases: anagen, growth phase; catagen, transition phase; and telogen, resting phase. During the anagen phase, hair cells divide rapidly, creating new hair growth. This phase can last anywhere from 2 to 7 years. The catagen phase is a transitional period of about 2 to 3 weeks when growth stops and the hair follicle shrinks. Finally, during the telogen phase, the hair rests for about 3 months before it's shed and new hair begins to grow. Understanding this cycle is fundamental in grasping why hair loss occurs. Hair loss, clinically known as alopecia, manifests in various forms, each with distinct causes. Androgenetic alopecia, commonly known as male or female pattern baldness, is a genetic condition that affects millions of men and women worldwide. This type of hair loss is mainly due to a genetically predisposed sensitivity to dihydrotestosterone, DHT, a hormone that shortens the anagen, growth, phase and extends the telogen, resting, phase of the hair cycle. Telogen effluvium is another common form of hair loss where significant stressors, such as childbirth, major surgery, severe illness, or psychological stress, push a disproportionate number of hair follicles from the growth phase into the resting phase, leading to substantial shedding after a few months. Alopecia areata, an autoimmune disorder where the body's immune system attacks hair follicles, causes patchy hair loss, typically in small, round, smooth patches. When it comes to hair loss treatments, it is always recommended to consult a dermatologist or a trichologist for a comprehensive understanding of the underlying cause and suitable treatment. The most commonly recommended remedies include medications like Minoxidil and Finasteride. Minoxidil, known as Rogaine, is a topical medication that stimulates hair follicles and extends the anagen phase, leading to thicker, longer hair. Finasteride, marketed as Propecia, inhibits the conversion of testosterone to DHT, helping to slow or reverse hair loss in men. In recent years, treatments such as Platelet-Rich Plasma, PRP, therapy have shown promising results. This therapy involves drawing a person's blood, processing it to increase the concentration of platelets, and injecting it back into the scalp. These platelets release growth factors that stimulate hair growth, increase the hair shaft size, and promote the survival of hair follicles. Surgical intervention, such as hair transplantation, is another option for individuals with significant hair loss. This procedure involves moving hair follicles from an area with plenty of hair to an area with thinning or baldness. Furthermore, lifestyle plays a crucial role in managing hair loss. A balanced diet, rich in protein, vitamins, particularly B, D, and E, and minerals like iron and zinc, supports hair health and growth. Regular exercise, adequate sleep, and stress management also contribute to maintaining a healthy hair growth cycle by enhancing overall body health and hormone regulation. As research progresses, more potential treatments for hair loss are being uncovered. One recent study conducted on mice suggested that a drug initially designed to treat osteoporosis might hold promise for treating hair loss. The drug, WEI-316606, targets a protein that inhibits hair follicle growth. However, more extensive trials are necessary before it can be approved for use in humans. JAK inhibitors, drugs initially developed for the treatment of cancer and rheumatoid arthritis, have also shown potential. Clinical trials revealed these drugs might help regrow hair in people with alopecia areata and potentially even androgenetic alopecia. Genetic research is another promising frontier in the quest to understand and treat hair loss. Scientists are studying genes responsible for hair loss, and their understanding is growing. Such research could pave the way for gene therapy in the future, where doctors might modify or regulate the genes causing hair loss. While these therapies and interventions are important, prevention remains the most effective strategy. Noticing early signs of hair loss and seeking professional help can prevent further deterioration. This may involve frequent scalp examinations, a careful review of your hair care routine, or tracking excessive shedding. Hair loss is a multifaceted issue with various causes and treatments. While genetics play a significant role, factors like diet, stress, and underlying health conditions cannot be discounted. Current treatments range from over-the-counter topical solutions to advanced procedures like PRP therapy and hair transplantation. Emerging research, including potential new drugs and genetic studies, offers hope for more effective treatment options in the future. However, prevention and early intervention remain key in managing this universal yet personal issue. As with any health concern, it's always best to consult with a healthcare professional for personalized advice. And that brings us to the end of our deep dive into the world of hair loss. It's clear that hair loss is a complex issue, with a variety of causes and treatments. We've talked about everything from the hormonal and genetic aspects to the role of diet, stress, and general health. We've explored current treatments, from topical solutions to hair transplants, and looked at the exciting potential of future therapies. But remember, as always, prevention is better than cure. Spotting the early signs of hair loss and taking action can make all the difference. As always, we recommend seeking professional help for personalized advice. If you found this video helpful, don't forget to like, share and subscribe. See you in the next video. Until then, take care of yourself and your hair.